Okay, I think we can get started. So thank you so much for joining us here today. Welcome to our third webinar. Perhaps some of you have been to our prior webinars in this series of empowered Peel communities. That's how we describe this series of ours. And today's webinar is called Frontline Support for Newcomers and Immigrants in Peel Region. So welcome everyone to this third webinar in our series. Before we go into the content of today's webinar, we'd like to do a land acknowledgement to recognize the space on which we reside here in Peel Region and as a source of thoughtfulness on how we can move forward. We wish to acknowledge the land on which we gather, which the PMC, Peel Multicultural Council, operates here in Peel Region as part of the treaty lands and territory of the Mississaugas of the Credit. In particular, we acknowledge the territory of the Anishinaabe, Huron-Wendat, Haudenosaunee, and Ojibwe Chippewa peoples, the land that is home to the Métis, and most recently, the territory of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit, who of course were in this land that we now describe as Peel Region, Mississauga, Brampton, and Caledon. We have a great team of partners that make this project possible. And so we wanted to share that here as well. You can see at the very top, we have our project funder, Canadian Heritage, and core partners starting with Peel Multicultural Council, or PMC. Naveed Chowdhury is the Executive Director, Jagdeep Kaly, Settlement Services Manager, Linda Wang, who I think you can see here in your gallery view, Community Connections Coordinator, myself, a consultant to support this project, and the team at Amplify Engagement, who are an essential part of this project. We have Saskia Kwan and Janine Paul, both principals at that organization. You can see them as well here today. And Fatima Khan, Communications Specialist at Amplify Engagement. Some housekeeping before we get into the content for today. We encourage you to speak up and share your ideas. There's a few ways to do that. You can use our chat or Q&A feature, but please do keep your comments and feedback respectful and mindful of everyone you're sharing with today. Like I mentioned, there is a Q&A feature, so you'll see that just in the toolbar at the bottom of your screen. And if you click that, you can submit questions, which we will answer after the webinar portion, the presentation, I should say, is complete. If there's anything also that you're confused about or unsure of, there may also be any audio or video issues, please let us know in the chat, and we're happy to address those as those questions or feedback come in. So the first portion of this webinar, the presentation, will be recorded. It is currently being recorded, and this will be shared on the PMC YouTube channel for the many who cannot join us at these webinars live. We will not keep the recording or post the Q&A portion which follows. So we're being mindful of your privacy and sharing in a safe space. Any feedback you wish to share with us, we'll be sure to take notes and incorporate that into the larger learnings, but the recording will not be shared once we have the Q&A session. Okay, let's talk a little bit more about this project. For some of you, this might be your first time hearing about the project, so we wanted to give you an overview so that it makes sense. So this project is really looking at the period of time in the pandemic. Unfortunately, both the media and the public at large have often described communities within Peel in racist and stereotypical ways, and this is especially true for minority groups, racial minority groups, and those that might already be on the margins. Evidence shows that higher rates of COVID-19, while there were instances of this, they were often a result of inequality and injustices, which may not have received the same amount of attention. So this project is really meant to empower community voices and help share their perspectives on the discrimination, the racism they may have faced during the pandemic, even today, and challenge these narratives and look at what are some solutions to break the stereotypes. This webinar, the third in the series, is one of three, of course, which share reflections gathered from community members, which include organizations and frontline workers, such as many of you attending today, on the reasons behind these racist representations and what changes we are suggesting as a community, the members who have shared their feedback with us for a more equitable and respectful society. So we have collected feedback through consultation with these community members in multiple focus groups, and we'll be sharing some of those findings specific to the frontline workers' perspective today. So hearing from the sector, there's a lot of voices and a lot of feedback that has been given so far. However, we want to continue that conversation. So as we go through the questions we've explored and the responses we've received, please consider adding your own feedback if you feel like it isn't represented or if you want to reinforce what you have already heard. This is a look at some of the core questions we asked our focus group sessions. The first was, were there any stereotypical and racist behaviors, attitudes, or media stories that led you to believe that minority or racialized communities were overly targeted during the pandemic? From there, the question went to, what could have been the reasons for these stereotypical and racist representations? Why was it happening? And finally, an analysis on what comes next. What needs to change for Peel communities to be fairly represented by the public and the media in the future? What do people in a position of authority need to better understand about minority/racialized communities in Peel? So this was really about moving towards solutions, moving from these were the challenges we faced to this is how we can do better as a society. So let's talk about what we heard. And we've broken this down into 3 categories as well, roughly aligned to these questions, to look at what was heard, why was it that these were the representations made, and what are some solutions moving forward. Peel region is fairly unique in Canada. There are still very few cities that have the level of density and diversity as Peel. And as we've highlighted in our prior webinars, one of the real highlights of discrimination was not so much a spotlight, but labeling as a hotspot, which is a place of undesirable health outcomes. So what was often heard in the media from the frontline workers, from the community members who shared with us, was Peel region was highlighted in a negative light more often than not during the pandemic. There were community members who were often felt like they were blamed for what was happening here with the COVID-19 case counts, and the solutions were not presented alongside that blame. And this goes to feeling like those who should be supporting the community were not there to provide that support. Positions of authority not providing the representation of the local situation, as was described by focus group participants, the uniqueness of Peel meant that often residents, newcomers, frontline workers were hearing from authorities such as politicians, media, health representatives as to the challenges without why were they taking place? What were the gaps in support or ability for the community to overcome this virus? There was this dichotomy of public appeasement versus public health. And so politicians, for example, community members shared with us that politicians may often had to pivot, changing policy, not because it was in the best interests of health, but because it was demanded by the majority or the loudest voices. And an example which was given was the removal of mask mandates and the reduction in promotion of wearing masks and getting vaccines or vaccinations. Another example was the usage of bad news or negative news as a way to continue to bolster views, clicks, likes in the media ecosystem. Something that is already well known and common within media, as was shared with us. Was it leading to positive outcomes for the community, or was it simply leading to more views of the stories? cultural elements lost in translation. And this bullet point is a little bit more loaded in the sense that there was often limited information provided in multiple languages on the solutions to managing the health care that was missing in some of these communities. So for example, where to access personal protective equipment, where to access vaccines, and where to access healthcare best practices in a language, in a location that makes sense for that community, such as communities that are not speaking English as a first language. So very common within Mississauga and Brampton, especially among newcomer population. There was also the fact that, for instance, communities that were facing Asian hate or were facing racism, such as in the South Asian, Black, and Chinese communities, there was a lack of representation of why certain elements within cultural groups, such as multifamily housing or multi-generational housing, or use of PPE regardless of public health guidance. So an example was given, wearing of masks within the Chinese community as a way to protect their health and protect the health of those around them. This was often associated with something negative as a form of a reason to be afraid of this community or to further marginalize them, rather than as a source of pride or a source of care. So when the media did not talk about these local nuances, particularly within different cultural groups, you had a lot of members of the community, again, here within the focus of newcomers, that did not have access to the information they needed on how they can protect themselves. There also was the perception from community members that shared with us of a divide between the Western world, so to speak, and the Eastern world, with a sense of superiority among Western communities and cultures that further exacerbated the stereotype of looking down on Chinese, South Asian, Black communities, as an example. And this goes back to groups which were already facing discrimination, such as Asian hate, which came up more in the media, would often pay a much higher price now due to not having access to healthcare supports in the pandemic. And so often what you would see, as shared with us, seniors, international students, many of which are newcomers, those without a family doctor or without access to insurance, and marginalized groups in general. So those of newcomer background or those of minority groups that may not have English as a first language and may not have access to the translation or the resources in a way that makes sense to them. They were often literally paying the price. So either higher costs to access healthcare or greater impacts from the pandemic and getting sick. These were some of the challenges Peel community members shared with us, particularly the frontline workers, on the discrimination faced in Peel region. So then thinking about that second question, that second part, what was leading to this representation of the community, these stereotypes? And this ties back to the lack sometimes of that cultural literacy or that storytelling from the front line, from the grassroots, from the community members themselves. A lot of stories were written about Peel region. However, they didn't always capture or ask those on the front lines themselves. So this could be what's called a frontline worker. So for example, those within the settlement sector, healthcare, and education, or it could be those on the front line facing the health impacts, such as the communities we just spoke about, newcomer communities, international students, etc. Their perspectives were rarely captured based on what the focus group members were seeing in the news articles that talked about those very communities. And so there was this gap of knowledge, or at least perceived knowledge, again, as the community members have shared with us, between what was written and what was happening in the communities themselves. reporting in silos. And so this feedback was looking at kind of how these questions themselves were structured. There was the stereotypes which existed and in some cases were perpetuated. And there wasn't always introspection. So in other words, a reflection by the groups that were reporting as to why is this such a big problem? So why are there higher case counts in Peel region? And how can we, those in positions of authority, those reporting on these issues, how can they help? And community members would share things like providing more multilingual reporting, so reporting in more languages. And communities would say also, why are certain communities or neighborhoods targeted with negative news without the supports that that community might need to overcome them? So examples were given, South Asian communities where many people were living in closer proximity for reasons of access to the housing, or because this was a cultural norm. How can they manage isolation when they get sick in the pandemic? There often wasn't news talking about how to manage those health outcomes. Another example that was given was members of the community who are students who need to still go physically to school, or workers who need to still physically go to the workplace, particularly in warehouses, light industrial spaces, such as in Brampton. It was often highlighted that these locations had high case counts, again, without the why and how do we or how can we help. Another note that was given, albeit briefly, was when there were factual errors made, such as in the number of cases or the location or cause of high case counts, the corrections, as is the case for media articles in general, were often very minor and brief and not picked up by the public or by other media outlets in the same level of intensity. And so you would have a correction, a small little paragraph in the corner of an article or in the corner of a newspaper, a short sentence in a radio show, but it would not have the same traction as the original, more stereotypical, more misinformed, or more discriminatory article or post which was created. And so the community would feel like once that information is out there, the damage has been done. And this could further perpetuate the stereotype, even after, for example, the pandemic case counts had subsided. Authority at a distance. Now, this is speaking to the disconnect between, here we spoke about frontline workers and frontline communities not having their voices at the table in terms of the reporting done or the local storytelling or lack thereof. The other element here was a sense of distrust or being let down by those in positions of authority, such as politicians, members of the media, frontline health reporters, etc. Because if the supports were not offered, again, from the what to the why to how do we help, communities started to feel like they're not there to support us. They're just there to vilify us or speak of us in a negative light. Many community members wondered, were political messaging, was it part of supporting the politicians' own goals as opposed to helping these communities? And how does the community, especially those that may not have always used media as a source of regular information, mainstream media, how do they identify what's factual and what's not when every media outlet is reporting on the same story in a different way? And so levels of confusion, levels of lack of trust, and feeling like solutions were not being presented to these communities led to not having as much faith in these positions of authority. There was also a mention that when concerns were raised around large numbers of people gathering or large numbers of cases within the warehouses, for example, there would often be, again, the perception from community members, increased enforcement and punishment, such as fines or tickets to members of minority communities. And so the example was given of South Asian community members that were gathering, but other community members who had similar gatherings such as those who may be non-newcomers, who may be Canadians here for some time, they would not often face the same consequences. So there was this perception that authority was punishing certain communities more than others, or helping certain communities more than others in the pandemic. And all of these findings spoke to the many examples that were shared of, we have faced stereotypes for some time. We have already faced discrimination before this pandemic. And this instance now is not helping. It is making things worse in that other community members outside of our community, so for example, the larger population of Peel or the larger population of the GTA, is now perceiving Peel Region, Brampton minority communities in a more negative light than they once did. How can the reporting, how can these positions of authority, how can they work to reverse this trend and work towards solutions and a more respectful treatment of Peel Region? And that goes towards the third question or area in this presentation here, moving towards solutions. And there's a lot. There were so many solutions shared by community members, so many ideas, and we welcome your feedback as well. What are some of the things you want to see in how we can address this discrimination or this treatment of community members, frontline workers, and those on the margins in Peel? One of the things which was highlighted, and this has been true for our prior webinars as well, is ensuring there is space for community voices to be heard. Frontline workers shared feedback a step further, which is ensuring there is space for community leaders as well, local representatives that are speaking to health challenges, but also health solutions and outcomes, to have a seat at the table. So this could be a seat at the table of media, which is reporting. It could be among larger organizations, which are gathering healthcare community leaders and professionals. And it could be among politicians who are seeking different groups for advice. Are they coming to the community leaders before they speak to the challenges and the opportunities within a given area? Members felt like this is an untapped solution at this time, and it needs to be considered more. Better supports for newcomers. Now, of course, for the frontline workers, for example, within the settlement sector, this is particularly important. And Peel Multicultural Council, the core partner in this project, can attest to that, as can those staff members who have shared their feedback already. This was divided into a few categories we saw in the feedback given, in how can newcomers be supported to be more resilient and have greater capacity to manage certain challenges such as this pandemic, but also such as the treatment and impacts they face on a day-to-day basis. How can those stereotypes be diminished through the supports provided to newcomers? Cultural literacy for the public was encouraged in regards to how media can be more informed and how the general public can be more informed from the media. In this case, it is more internal. What additional supports can be provided so that international students feel more secure and that newcomers have access to the jobs they need with the sufficient training and education supports that may need to be added once they move here? Many felt like they would be stuck in low-paying jobs or unable to utilize their existing education because of the system as it is today. That made it all the harder for them to move away from jobs that might have been a higher health risk during the pandemic. So being able to work from home was often a luxury when many were forced to go to warehouses, for example, to support production of PPE, delivery via vehicles, etc. Another major gap, which was highlighted earlier in the challenges, was the lack of multilingual supports or information provided to the public. And again, this would be all the more important for the newcomer communities where many are either improving their English or do not have English as a first language in their repertoire. Many may not have access to primary healthcare providers, to insurance, and to the medicines they need should they get sick. So better supports for newcomers in the programs and services that are provided once you are a complete citizen, once you have access to healthcare and insurance, providing those supports, particularly in the time of a pandemic, was highlighted as something that could have really reduced some of those divides, some of that discrimination due to people simply having access to fewer resources. The settlement sector also highlighted that they could be the providers of some of these supports, as they are, as frontline workers, they're also on the front line, the front-facing individuals for these newcomers as they are coming into Canada and doing their best to live, work, and support themselves here. So this was a really large set of recommendations across many different participants, and we've tried to capture it here in three fairly general themes, but please do consider adding your feedback to these types of recommendations, because I'm sure there are many more to be added. And then finally, thinking about establishing this foundation of supports for newcomers, for those that were facing discrimination or stereotypes here in Peel region, longer term investment was needed to address those longer term stereotypes which have continued for these communities and for those specifically living within Peel. Looking at investment for greater capacity in healthcare and education could have been one of the major supports to prevent the outbreaks and the level of case counts that ended up giving Peel region that very label of, as we said, hotspot Peel. Many of the participants, and this goes across all of the focus groups we had, felt like there weren't enough supports there to effectively access medication, isolate, access personal protective equipment, and avoid places, again, such as the workplace, where there could have been already high numbers of individuals sick. So this longer term investment is, I think, an important recommendation, less so for the frontline workers themselves, but for the community which is engaging with them and for Peel region as a whole. So we hope that these recommendations and these solutions that were proposed by the frontline sector, by the settlement workers, can be something that continues to be expanded and shared with other settlement agencies, with other healthcare providers, with media, and with levels of government. So looking at what we've heard so far about what were the stereotypes and types of discrimination faced in Peel, why it was happening, and what are some ways we can move beyond this, we want to hear from you. And you can see there's other ways you can keep in touch with us. You'll have a chance to share our webinar on social media very soon. And this will also be shared on Peel Multicultural Council's social media, so you can connect with them as they continue to share updates on Twitter, Instagram, Facebook, and YouTube at Peel MC. And you can also continue to share your stories and your feedback, the lessons you heard about, or the solutions you wish to share by tagging Peel Multicultural Council, or you can also use the hashtag #EmpoweredPeel. So a hashtag we designed to work towards those solutions. We hope when our webinars are posted that you will consider liking, commenting, and sharing there as well. We want to have that conversation keep going for the weeks and months ahead. And so you'll find that on the YouTube channel coming up in just a few days next week. Well, thank you to everyone for listening in, for considering the suggestions and ideas that have been brought forward by the community so far. We really appreciate your time. Many of you may be working right now, so thank you for taking some time out of your busy day to be here with us. And thanks to everyone who has supported this project with Peel Multicultural Council, Amplify Engagement, and Canadian Heritage as our funder. Okay. There you go. So I'm going to there we go, get to that last slide there. Thank you so much to everyone for your participation here today. And please look forward to us sharing the webinar portion, the presentation portion of today's session in the coming days. And I wish you all the best. I wish you a great rest of your week. Thanks, everyone.